In this video, we'll discuss how high prescription copays and other out-of-pocket fees can dangerously impact patients' use of medications, an issue commonly referred to as financial non-adherence. In recent years, health plans have shifted more and more of the cost for prescription drugs onto patients. Out-of-pocket costs keep going up. Patients face higher copays or coinsurance rates to fill prescriptions and must reach a higher deductible before insurance covers part of the cost. Financial non-adherence is when a patient does not follow their prescribed treatment plan due to its cost to them. Because of cost, a patient may cut pills in half to stretch a prescription. Some even abandon their medication altogether. This is the sad reality for too many Americans. One study found that prescriptions with $40 to $50 copays were 3 to 5 times more likely to be abandoned at the pharmacy than prescriptions with no copays. This is true even for life-saving drugs. Research has shown that nearly 50% of cancer patients with the highest out-of-pocket cost abandon their prescriptions. Overall, patients who delay or abandon treatment are at a higher risk for expensive emergency care, longer hospitalizations, worse health outcomes, and increased death rates. In the following story, you'll hear about how financial non-adherence can affect patients.
So in March of 2020, I received my diagnosis that I had breast cancer. My oncologist prescribed my oral chemo medication, and my pharmacy called me and said, your out-of-pocket cost is $3,005. I called my insurance company and I let my insurance company know my situation. I told them I don't have $3,005 for my medication. And they said, unfortunately, Miss Anderson, there's nothing we can do. That's your insurance policy and we have to adhere to it. And you need to come up with the $3,005 if you want your medication. So I had to do without my medication for 71 days. I also finally had my mammogram and ultrasound 2 weeks ago. And unfortunately for me, I have to do a biopsy tomorrow because they found something. So I don't know if it's because I went without my medication for 71 days. I just want insurance companies to know that patients want to live. I think it starts with your employer finding the right insurance companies for their employees.
Employers can help curb financial non-adherence by choosing benefit plans that avoid high copays and other cost-sharing burdens, particularly for drugs that manage chronic conditions and serious illnesses like cancer. To learn more about how utilization management can affect patients, please refer to the booklet Best Practices for Prescription Drug Benefit Design, available at cancercare.org, and view the other videos in this series.